very exciting day at Circle Reading. It's the official launch and announcement of the partnership that Circle Reading are undertaking with the GB rowing team. We have 3 of the elite athletes who are currently undergoing rehabilitation coming to the hospital. We're going to be meeting the team, the physios, the nursing staff. We're going to look at our fantastic equipment that we've invested in to enhance the pathway for all of our patients who come to us.
Injury is something you don't necessarily always want to plan for, but it does happen, and we've got fantastic doctors and physios at GB Rowing, but sometimes you need that outside help. I've been to Circle once before and that experience was really good, and it's good to be back here today and get a more in-depth look at the facilities.
This is one of our general X-ray rooms. We may use this room from your point of view to make diagnoses of bone or kind of joint problems.
After the 2015 season, I had a bit of lower back pain and I had to go for an MRI scan. It turned out I had 2 bulging discs in my back, so I had to go for an injection and go through an extended period of rehab.
We do train really hard every day, niggles do occur. Getting them sorted as soon as possible is almost like a safety net to us as athletes, because we want to get things sorted and done so we can get back on the water, because that's what we do.
Outpatient physio department here, we see a whole range of patients in the hospital: orthopaedic outpatients, self-referred patients, sporty types. We're very lucky that the hospital's invested quite heavily in equipment in the department in the last 6 months.
As an athlete, you always want to know that things are on the cutting edge, and it seems like I've got a lot of innovative equipment in there that could really help somebody like myself or my fellow athletes.
Have you ever seen one of these before?
Yeah, I have.
Have you ever been in one?
No.
Do you want to have a go? If you've got an Olympic rower who needs an alternative cardiovascular exercise to do, getting in something like this is ideal.
The benefit of quick access diagnostics means that I can work out for the athlete what we need to do. We sometimes have very little time to make quite critical decisions, and if somebody has an injury, I need to try and ascertain very quickly what we need to do and action whatever that treatment might be.
The hospital, we've looked around today, it's been absolutely fantastic. I mean, I'm not a massive fan of hospitals, so coming in and seeing that it's more like a hotel, it's just a lot less hospital-like, is really comforting.
It's really good to know that if something does unfortunately go wrong, we're going to be getting the best care that we possibly can, and I think we're really lucky to have that.
The feedback will be really positive to the guys to say, look, we've got a really good partner on board here, and this is something we can all feel really supported and secure in if we needed to have some sort of intervention.
British Rowing and Circle Health have very similar missions. They want to strive to be the best at what they do, and for us it will give us marginal gains in terms of our performance. We're looking for minutiae of improvement, and anything we can do to help the health of the athletes is like fueling the engine and making the boat go faster.